Hello, I'm Eric Sinknecht, and this is my colleague Veronica Gold. And we are happy to present today to you on ketamine-assisted psychotherapy.
And we are in San Francisco, California, and we work at Polaris Insight Center, a clinic providing ketamine-assisted psychotherapy and training. And so a brief introduction. Ketamine is medicine that's been discovered in 1961 and was developed for anesthesia, and it is classified as dissociative anesthetic. But as well, it has psychedelic properties. And that is what has been an interest to psychologists and psychiatrists to see how this psychedelic effect of ketamine can help treatment. In the last few decades, ketamine has been studied for treatment of treatment-resistant depression, but as well for treatment of anxiety, PTSD, and in the medicine side as well for treatment of pain conditions.
In the late 1970s, two notable people, John C. Lilly, physician, inventor, psychonaut, and psychoanalyst, and Marcia Moore, a astrologist and yoga instructor, both self-experimented with ketamine on multiple occasions and wrote up their experiences in these two books. And we really owe them a great debt of gratitude for contributing greatly to our knowledge of the phenomenology of the ketamine experience. So what does ketamine feel like? For those who have not experienced it, it's the chemical version of an isolation tank or a flotation tank. So there's a reduction of external stimuli and sense information through the sense organs, and a heightened engagement and appreciation of one's inner world. People have, at higher doses, it does have psychedelic properties. People have out-of-body experiences, near-death experiences, mystical experiences. And one of the very interesting things about the therapeutic aspect of this molecule is people have an experience of distance from their conditioned mind, from their depressed mind, from their anxious mind, and they can witness the conditioned mind from a distance, from an observing ego or witness self.
And so we want to talk about 3 paradigms of treatment with this medicine. And these were described by Raquel Bennett, who is one of our trainers, as well as Phil Wolfson and Julian Andries. And so these 3 paradigms are medical, psychological, and transpersonal paradigm of working with the medicine. The medical is really looking for the symptom reduction and looking at the neurobiochemical impact of the medicine. And the psychological paradigm is really looking at the psychotherapy that's facilitated by the medicine. So looking at processing biographical information, experiences, traumatic experiences. And then in the transpersonal shamanic paradigm, really working with these mystical, non-ordinary states of consciousness. And so here, there's just a quick look into some of the clinics. So here is the medical model IV infusion clinic where the patient sits and gets a drip as the IV. And this is one of our treatment rooms.
So this is a model of the collaborative approach between the psychiatrist, the therapist, and the patient. And the focus of our approach is really on the therapeutic relationship, building a strong therapeutic alliance so that it can provide containment for the process. We use attention to set and setting, selected ketamine playlists, preparation and integration, and each experiential session is 3 hours to really allow for processing of the material that comes up in the medicine sessions.
And I just want to emphasize here the importance of the collaboration that is a little bit unusual, that the prescriber is the one who is assessing and prescribing the medicine, but really as well, then the decisions are informed by the psychotherapist and the patient, and kind of this feedback and collaboration that creates the alchemy of the ketamine-assisted psychotherapy. We pay great attention to the issues of transference and countertransference in the therapeutic relationship that are even heightened compared to regular psychotherapy in this vulnerable states working with the medicine. So here, want to just mention briefly kind of these broad strokes of the transpersonal shamanic model of working with the non-ordinary states of consciousness and the healing and transformative potential of clients going into these states. So in this way, we think about ketamine as an advanced psychedelic, that really the high doses of ketamine can feel like similarly to high doses of LSD or psilocybin, and that the clients can heal through that experience. There is as well this potential of the evolution and shift, how we think about the model of the psyche and the model of our consciousness, and really the model of healing, how we look at healing in the Western psychology and psychiatry when we take in this importance and the possibility of these non-ordinary states of consciousness. And so here we're showing some of the typologies where we can see the different areas which people can process with the medicine of ketamine. And some of these are based on the work with LSD and holotropic states, and then Eli Kolb is based on work with ketamine. And that we see with our patients all of these areas that people work through when they come to working with ketamine, from biographical, perinatal, to more of the transpersonal mystical realms.
So one of the principles that guides us in our work is trust in the inner healing intelligence. And the inner healing intelligence is this natural, spontaneous, intuitive, largely non-rational, and really unpredictable capacity within each of us to heal. We talk with patients about having beginner's mind and not having any expectations or plans about the experience, and really trusting that their inner healing intelligence will go to the material that it needs to go to in order to heal and move towards wholeness. And on our end as the therapist, we really try to put aside our agenda and our concepts and our ideologies, and are open to the patient learning from their experience, to focus on experiential learning and knowledge as opposed to concept and ideology driven learning.
So here we have a short, just kind of a graph of the overview what a treatment looks like from, when people enter to the treatment, from screening over the phone to go through the medical and psychological intake, doing assessment measures, and that there are preparation and integration sessions on each side of the ketamine-assisted psychotherapy session, which is this 3-hour session. So that there is a great emphasis on extended preparation for the experience or the series of experiences, and then the integration. And the treatment is individualized, so some people come for 2 or 3 sessions, while others will do series of 6 to 10 sessions. But this kind of overview kind of repeats in the process. So here are just some quick notes on the medical screening and looking for drug interactions, and really preparing the patient so they can feel comfortable going into this experience. In the psychological intake, we are as well doing collecting measures that we as well then use during the treatment to track the progress.
Here's a picture of one of our treatment rooms. You can see the patient lying in a relaxed position, and she has eye shades and headphones on and is listening to a selected ketamine playlist. And in terms of set and setting, particularly regarding the mindset of the patient, we really want to explore their thoughts, beliefs, and attitudes about the use of psychedelic drugs for healing, about their ideas about healing itself, and any biases or judgments that they have from their past experiences, and really kind of have conversations and discussions about that. As well, as therapists, we want to reflect on our biases and judgments about psychedelic drugs and more broadly the healing process, and really get clear on our beliefs and what we're bringing into the session. The intention of the session, the intention of the patient is important. We talk about that in the intake and the prep sessions. The patient is coming for a reason, is coming to heal something or get clarity on some issue in their life. And we use invocation in the beginning of the experiential session to prime the patient to connect with their intention and to connect with their heart and to enter into a more meditative state of mind.
So here we want to give you a little tour through how our clinic and setting of the sessions look like. And here in the left in the corner, you can see the different ceremonial objects we use. So we have their Palo Santo, there are some medicine cards, and we are holding these experiences as extraordinary experiences in one's life and holding it as a ceremony and the, shamanic transpersonal context of the work, and invite people to really approach these sessions in that way, as oftentimes the clients will report that the ketamine experience has been the most important or most life-changing experience they've had in their life, or one of the most life-changing experiences. And so we really want to honor that process and emphasize the holding of that. So these are some of the other rooms in the clinic, so you can have a sense how that feels like. And here just briefly, the difference between the dosages in the sessions and how the treatment feels on the lower and the moderate and high dose. We start everyone with a low dose, which some people will stay with because that really allows for the psycholytic therapy and processing of the material, to go to the more of the moderate and high doses where they might experience more dissociative effects and more psychedelic effects. And so this dosing strategy is for IM administration. So ketamine is used IM, intramuscular injections, intravenous IV administration, and with lozenges that are sublingual. So this is the kind of bioavailable dosing strategy. And with the lozenges in the United States, these lozenges are prescribed to the patient as by a compound, they pick it up in the compounding pharmacy, and they bring them into the sessions, put them in their mouths, and have them dissolve. And in about 15-20 minutes, they start to feel the effect of the medicine. It is, less invasive than the IM or IV, so in that way more suitable for some patients as well. There is a more gradual onset, and so the transition to the non-ordinary states feels smoother for the client. In the IM administration, there is a faster onset of the medicine, and there are some less side effects, like a nausea connected with using of the IM ketamine. And we usually start our patients with the lozenges, and then once they get more comfortable with the non-ordinary state, we will switch to IM administration. But it's very individualized, and some people will only work with the IM or only with lozenges.
So ketamine is a really safe drug. The most common side effect we see is nausea. some people report dizziness, blurred vision for some time after they come down from the medicine effects. With chronic abusers of ketamine, a small percentage of them develop bladder cystitis. We've not seen that in our clinic. And then we always want to be aware of the potential risk for like non-compliance, diversion, and addiction. We have not seen that much in our clinic either. Ketamine can be psychologically addictive. It just does not develop. People don't develop a physical dependence with ketamine. We have not seen people develop addictive relationships with ketamine in our clinic. I think mainly due to the way that we approach the work with attention to preparation, ritual, and the therapeutic relationship.
So I'm not going to go too much into this, but really these different challenges can be addressed through the preparation, the ongoing sessions, integrations, and as well collaboration with other providers, other therapists, other psychiatrists that the patients are working with.
So integration is an important part of the process. In integration, we hope to make meaning, help co-create meaning from the images and visions that people have during the experience. We have the potential to repair attachment wounds through the continuity of the therapeutic relationship. We work with transference and countertransference and use that to speak to various patterns that we see that can help increase awareness of the patient's relational patterns. We process traumatic experiences that come up and make meaning out of those. We help them to integrate spiritual experiences into their worldview and their view of themselves.
And so we're going to the end of our presentation. So please feel free to reach us if you have any questions, want to connect with us. We as well have developed a training program for ketamine-assisted psychotherapists, which is a 5-day didactical program, and as well with a role plays and experiential trainings that we provide in California. And this program is still in development. And really we came to creating this by thinking about what we haven't been trained on, or what are the challenges that come up in providing ketamine-assisted psychotherapy, and how we can optimize the experience and prepare the clinicians in the best possible way for working with patients. And we've as well been supporting people from other countries to start doing their ketamine practices, which has been very exciting for us. So here's our email addresses, and thank you so much for spending time with us, and we hope to connect with you soon.
Thank you, everyone.